Hey guys, this is Dr. Hub. Today we look at the features of the peripheral blood smear, and this is in different anemias. So first is we look at the type of anemias. That is, we are dealing with the microcytic anemia. So this microcytic anemia, the diagnosing is it as a thalassemia trait. So here the PBS, the peripheral blood smear, it shows a basophilic stippling. So basophilic stippling can be seen, as well as the presence of the target cells. Next, we look at the iron deficiency. So in terms of iron deficiency, it can be presence of the elliptocytes. There is presence of elliptocytes as well as the target cells. Then we look at the sideroblastic anemia. So under sideroblastic anemia, it includes the Pappenheimer bodies, then also the RBC dimorphism. Then comes the ring. There is a ringed sideroblast. That is a pearl stain. Ringed sideroblast, nothing but the pearl stain. After this, we look at the macrocytic anemia. There is the macrocytic anemia. So under macrocytic anemia, there is we look at the diagnosing of the myelodysplastic syndrome. So under the myelodysplastic syndrome, what are the peripheral blood smears? How does it look? The peripheral blood smear, it shows a hypogranular. So there is hypogranular or the hypolobulated, hypolamellar as well as granular or hypolobulated neutrophils. And there is also the presence of blast cells. There are giant cells or the hypogranular platelets. There is giant cells or the hypogranular platelets. Then there are also the Pappenheimer bodies. Then comes the presence of minor. There is also the minor population. So this is of the hypochromic. So minor population of the hypochromic or the microcytic cells. So microcytic cells. So when you see these microcytic cells, they are dimorphic. The microcytic cells are dimorphic, as well as there is presence of the poikilocytosis. Then we will look at the megaloblastic anemia. There is megaloblastic anemia. So this includes the hypersegmented neutrophils. The hypersegmented neutrophils. So hypersegmented neutrophils we mean by greater than 5 lobes. Then there is also the ovulocytes. This is megaloblastic anemia. Then comes the hemolysis. So under hemolysis, there is a polychromasia. That is a purple. It has a purple reticulocyte, and this can be positive, negative spherocytes. Then we look at the chronic liver disease. So as per the chronic liver disease, it contains the target cells. Lastly, we will be looking at the normocytic anemia. So let's look at the normocytic anemia. So as per the normocytic anemia, let's look at the diagnosis. So the diagnosis here, it includes the hemolytic anemia. So there is the hemolytic anemia. So under hemolytic anemia, how is the peripheral blood smear? The hemolytic anemia, there is anisocytosis. Next is the poikilocytosis. Then there is also the polychromasia and the nucleated red cells. There is a nucleated red cells. Next we look at the hereditary spherocytosis. So here the RBC lack the central zone of PLAB. The RBC, they lack central zone of PLAB, and there is also reticulocytosis. This is reticulocytosis. Next, we'll look at the G6PD deficiency. The G6PD deficiency, that is a glucose 6 phosphate dehydrogenase. So G6PD deficiency. So in the peripheral blood smear, it will show the Heinz bodies, and it is revealed by special staining. So there is a special staining, and they are also known as the bite cells.